today's episode, we're going to be talking about what happens when you commission your team to chase the wrong kind of patients. Now, most doctors will say, no, I just want the good quality patients. However, I see it over and over and over again where the doctors are training their team to pursue patients that will never buy treatment. They might come into the office, but they'll never buy treatment from the office. And I understand the psychology behind it. I understand why the doctor is trying to help those people and they want to help them. However, they're not helping them. They end up not getting the treatment done. They end up not helping their team, and they end up just clogging up the whole practice with patients that are never going to accept treatment from you. So I'm going to give you a real example. I was recently talking with a client, and we were looking at some of their numbers, and we noticed that their team was actually trying to convert Medicaid calls. And this was an adult practice. And we said, hey, do you want Medicaid patients? And they were like, well, not really, but if they call, we'll try to convert them. One of the things about Trackable that we use, trackable.io, if you don't use them, you should. It has an AI feature that goes in there, and it measures qualified leads versus disqualified leads. And one of the features that it has is that actually when the office says, I'm sorry, we don't participate with that insurance, or we don't help patients with that insurance, or whatever, however you word it at your practice, it disqualifies them. It says this is a disqualified lead, and then it actually feeds back into the campaign, so that way you don't get more of those kinds of patients. But when an office is actively trying to pursue those patients, then it counts it as a qualified lead. So I was seeing that these Medicaid patients were falling into the qualified lead bucket when they should have been disqualified. So I asked the doctor, I said, okay, well, do these patients ever come in and buy treatment from you? And they were like, kind of, I think so sometimes, right? And so I was like, okay, well, I'm going to dig it up. So we went in to Trackable and we dug it up and we looked at all the Medicaid patients that came in. And guess what? None of them accepted treatment. Zero. This happens a lot. With Medicaid patients, it also happens with different, niche providers in different states. You know who they are. Like if I said right now, you're a doctor, you work in a practice, and I said, yeah, the patients, that insurance that they just never accept any treatment, you know who those people are. And so what ends up happening is you're trying to help a couple people. You end up saying yes to a bunch of people. Those patients come in, they clog up your schedule, and then you end up with an unhappy team. You end up not enjoying what you do. And the patient doesn't win either because they're like, man, this isn't aligned with what I wanted from my dental visit. And I'm not saying that we shouldn't try to help people. Of course we should try to help people, but that's not an effective way of helping people. And it doesn't help you or your team at the end of the day. And we have to use data to be able to understand this. We should not just be saying, hey, yeah, let's do that because let's accept these patients because we might be able to help one of them. Yeah, but what about the other 99 that came in that you weren't able to help? And again, your team's not happy now. You're not happy. Nobody's happy. And you just train the algorithm to give you more of those types of patients. So this is a problem that you can easily undo by just simply saying, I'm sorry, we don't participate with those type of insurances. Doesn't mean that you're going to get zero of them. Every market, there's a certain level of that. In some markets, there's a lot, right? There's certain markets in New York where half of your budget's going to go to Medicaid calls no matter what. Because somebody goes on and searches the word dentist, and it's like right next to your office, and half of those people are on Medicaid. So there's no way to weed that out, and that drives up your cost per lead and your cost per qualified lead. But you still don't need to clog up your office with those types of patients if they're not going to buy treatment. So that's my rant for today. Has that ever happened to you? If yes, stop it. Stop it right now. Don't do that anymore in your practice. I hope you have a good day. Drop a comment down below if you can see me and hear me okay. That helps me out. Take care.